from the hip to her neck to complete the movement. And again, do this as many times, repeat the sequences as many times as you feel is necessary. This is just a guideline, not really done in real time, but just gives you a sequencing for the strokes. Support the mother at her shoulder, and with the heel of your palm, come down all the way to her buttocks and make a large circle, and repeat with the same smaller circles on her sacrum. Remembering that this is a wonderful place for relief and the low back pain that a pregnant woman often feels. Now we will be finishing this side with a few more long effleurage strokes from her hip all the way up over into her shoulder. And you can finish off with some nice connecting strokes, fanning out over the back. Something just to feel like you're finishing and completing the upper torso and the lower part of the back. Now we will be moving down into the sequence for the legs, dealing specifically with sciatica, which is a painful inflammation of the sciatic nerve. During pregnancy, it occurs due to the pressure or position of the growing baby. The pain courses along the path of the nerve, which is in the middle of the back of the leg. It usually affects only one leg. Be sure that the mother's physician or health care provider is advised of this condition so that other pathologies or causes may be ruled out. Sciatica caused by pregnancy disappears after birthing. However, massage during pregnancy is very beneficial to reduce the pain. Since lying on her back might exacerbate the pain, the mother should be lying on the unaffected side for this treatment. Pillows placed between her knees and under her head. Massage only the affected leg, so we will be working with the affected leg. Now we're going to do each stroke 3 times using massage oil. We want to effleurage the entire leg, front and back, including the gluteal region. Nice long strokes, nothing too deep. We don't want to overtax the lymphatic system here. We have to avoid using any deep pressure. We're going to do this about 3 times. Circular kneading with one hand, including the gluteal region, relaxes the inflammation. And we want you to place your other hand on the mother's hip, avoiding any deep pressure. And we're going to go into the gluteal region now with the circular kneading. Now, using your thumbs, make small circles, tracing along her sacrum. This is where all of the 6 deep lateral hip rotators attach. So this feels especially relaxing to those muscles. Now with both thumbs, one above the other, make small transverse strokes or friction down the middle of the back of the leg, along the path of the nerve. This stroke is especially important to reduce the inflammation. A lot of times, if the nerve is inflamed, the hamstrings will tighten up and lock up. So this is very good for also reducing tension in those muscles caused by the tightening of the legs and the restricting of the nerve. Now repeat the first stroke of effleurage up the back of the leg. Tap gently with the back of your hand all along the back of the leg. Now the gluteals are next. Concentrate on the topmost portion of the back of her thigh directly under the gluteals. And do some gentle tapping with the back of your hand. Now we're going to come down into the lower part of the leg and do some nice gentle effleurage up the back of the soleus and the gastrocnemius, the Achilles tendon, and do some spreading strokes with your thumbs. This is also good to drain some excessive lymphatic edema. Nothing really deep, just nice gentle strokes. Now we're going to finish the massage on the leg with gentle nerve stroking up from the foot into the buttocks. Now when you repeat this sequence on the other leg, it's the unaffected side. You'll just do the effleurage and petrissage strokes, which we will show you when we turn the client over. Having turned Kim over to her other side, we are now working on the unaffected leg. So we will start by effleuraging the entire leg, front and back, including the gluteal region. And we're going to do this stroke about 3-4 times, depending on the tension, of course, in the muscle. I want to talk a little bit about stretch marks. There's nothing concrete to determine who will develop stretch marks during pregnancy. Sometimes they have determined that's a disturbance in the endocrine system, either due to pregnancy or rapid weight gain, and the loss of the integrity of the skin. It becomes lax. And once this happens, the stretch marks will not disappear, but they will, however, fade in time. There is a topical massage that you can use with herbs and vitamin E, coconut oil or olive oil may hasten the healing. A massage oil made up of 25 drops of lavender oil with an optional 5 drops of neroli oil and 2 ounces of wheat germ oil to be used after the first trimester may also promote faster